Welcome everyone, my name is Lottie Turner. I'm the Partnerships Director at Health Justice Australia, and it is my absolute pleasure to invite you all to this plenary panel discussion this morning on working together. Before we commence though, I would of course like to thank Uncle Ray for his warm welcome to country yesterday, and myself acknowledge the traditional custodians of the land on which we gather today, the Gadigal people of the Eora Nation, and pay my deepest respects to elders past and present. I want to acknowledge the sorrow of the stolen generations and the impacts of colonisation on Aboriginal and Torres Strait Islander peoples. In that, I further want to recognise the resilience, the strength and the pride of Aboriginal and Torres Strait Islander communities, and recognise that sovereignty over the land on which we gather today and sovereignty of the lands and waters across this great nation were never ceded. So I think a central theme of Health Justice 2019, as Tessa has already noted this morning, has been how can we explore using partnership and collaboration as tools to shift the dial in health and justice outcomes. We have invited three people here to speak on this panel this morning who I think it's fair to say spend a bit of their working lives and perhaps non-working lives thinking about that very topic. Now, unfortunately, Alistair Ferguson couldn't join us this morning, but we are really grateful to have Sarah Hopkins step in on Alistair's behalf, not speaking for Alistair, but sharing her own insights and experiences in the work she has done, standing with Alistair and others in the work of Maranguka and Burke. I will introduce our panellists each in a second, but I would encourage you to have the app, Health Justice 2019 app, at the ready to review their wonderful full bios as well. So Sarah Hopkins is next to me here, and Sarah is the Chair of Just Reinvest New South Wales and Managing Solicitor of Justice Projects at the Aboriginal Legal Service ACT in New South Wales. Welcome, Sarah.
Thank you.
Marcia Dwonzcyk, down the end here, is an innovation and change specialist with a focus on partnership and engagement. Marcia is also an associate practitioner trainer with the International Partnership Brokers Association. Welcome, Marcia. And last but not least, in the middle there is Kerry Graham. Kerry is the founder and managing director of Collaboration for Impact and lectures on collaborative practice at the Centre for Social Impact at the University of New South Wales. So please join me in welcoming the panel this morning. So Sarah, I'd like to start with you. I was going to start with Alistair today on this very topic. I think the work of Maranguka, in particular in Burke, is a great example of a place-based, community-led response to tackling something as complex as the ongoing impact of colonisation on Aboriginal and Torres Strait Islander peoples. Around this time last year, Alistair said in an interview with Inside Story that his community was, quote, on the road to recovery. A couple of months later, KPMG released an impact report on the Maranguka Justice Reinvestment Initiative, and I want you to bear with me while I run through a few numbers here. I think they're impressive, but then I'm interested in hearing your perspective on the human story that sits behind those numbers. So that report noted a 23% reduction in police recorded incidents of domestic and family violence and comparable drops in rates of reoffending. A 31% increase in Year 12 retention rates and a 38% reduction in charges across the top 5 juvenile offence categories. A 14% reduction in bail breaches and a 42% reduction in days spent in custody. And as a result of those achievements and achievements in other areas, KPMG estimated an economic impact of $3.1 million in 2017. And if just half of the results achieved in 2017 continued, an additional $7 million, a $7 million impact would be seen across that region. So can you talk to us a little bit about what role community-wide collaboration has played in achieving some of those shifts and what your perspective is on what it took to get you there?
Sure. I mean, it's a big question. I think from the outset, community-wide community-led collaboration has played a critical role. So how the Maranguka Justice Reinvestment Project initiated was Alistair reaching out to say, you know, the community has really been on the front foot for a number of years trying to find solutions, but working within an existing service system that was very siloed and ineffective. You know, so when Mick Gooder and I first went out to Burke to talk to the community, you know, the idea was the community wanted to actually sit in the driver's seat to lead the change, and the very strong sense was that the community had the wisdom, the knowledge about how to make the changes that were required in a place like Burke. So in terms of building that knowledge, there was always a strong foundation of community-wide collaboration. So the community came together for a number of meetings to express what they thought they needed in terms of the information, to really start identifying the problems and the solutions in Burke. You know, we were coming at it from, you know, really looking at what was leading children and young people into the criminal justice system. The community were clear that that trajectory was something that existed across the whole life course of children and young people. So they wanted to see data on what was happening with pregnant mums, what was happening with early childhood, what was happening in the education system, you know, drugs and alcohol and mental health, driver licensing, employment. So from the outset, it was always the community driving what would actually end up setting the agenda and setting the strategy. So we created a life course snapshot, and then there were community data conversations feeding into that sort of bureaucratic data that we could provide to the community. And those conversations took place at kitchen tables or in office spaces or down at the village, wherever it might be, that it was useful for, convenient for community to actually have that input into the knowledge building part of the work. So when the Burke Tribal Council came together to set the agenda and the strategy for Burke, it looked at that bureaucratic data that the community had asked for, but it also looked at the community conversations and their input into that data. And then it developed a strategy called Growing Our Kids Up Safe, Smart and Strong. And that collaboration now plays out across the structure of the process. So in the working groups, there's 3 working groups that now sit in Burke across early childhood, 8 to 18-year-olds, and the role of men. And there's also a cross-sector leadership group that addresses issues around service sector reform that's required. So to make sure that there's that level of authorisation and facilitation of the work on the ground. I could keep going for so long, but I feel like I should pause. And I mean, I think in terms of what's needed is that having that strong foundation where you've had that genuine contribution of community into that strategy has been so critical, because it's something that we keep coming back to in Burke, to say that this was what the community said needed to happen here. So when services start becoming siloed and government gets nervous, we can keep coming back to the fact that this was a community-defined agenda.
So, I mean, is it safe to say, though, that elevating that voice of community and that community control doesn't come naturally for a lot of organisations, a lot of institutions to do that in a genuine way? What did it take to get some of those institutions and organisations there in the work of Burke?
So it has really involved a need to change mindset of people working in those organisations on the ground in Burke, and most critically, people in government in more senior positions, you know, who are holding those funding contracts, to really have that message fed down into community and then feeding back up from community into their managers to say, look, we are trying to do something differently here in Burke. So what what might have been our traditional KPIs and the ways we work here and the ways we operate, it's not working. We know it's not working. We know there are a lot of resources coming into Burke for very little outcome. So that there has been some light bulb moments along the way where key people have said, okay, I get this. let's start doing things very differently.
And Marcia, it's not just the work of Burke, the work of community-wide collective impact approaches that can benefit from taking a principled approach to what they do, a values approach to what they do. You talk about that a lot in your work. Can you talk us through that, what we mean by that?
Sure. I mean, it's, as Robert said, you've got to come back to the basics, don't you? Why would we need to work together? Do we need to work together? Why do we need to work together? How do we need to work together? And there is a legitimate critique of partnering out there. And some of that critique is about, why bother partnering? It's business as usual because people wimp out. Why bother partnering? It's all talk, no action because people do get stuck in the talk. And the third critique is, don't partner, it's managerialist. It cuts out the very people that we're here to try and work with and support to make a difference. And so one of the key challenges is to get the foundations right. So as you said, I work with the International Partnership Brokers Association, and the easiest way to explain that is imagine a whole bunch of nerds or geeks in partnering in one space internationally, and that's the Partnership Brokers Association. And what we've learned over nearly 20 years of practice in real communities across the world is that there are no two partnerships that are the same, just like there's no two communities that are the same. This is not a Kentucky Fried Chicken model approach. It has to be a principle-based approach. It has to be about what do we mean by these principles in our place at this time, in our context. And I've never met a person, regardless of age, gender, culture, educational background, skills, who hasn't been able to tell me what it looks like to feel respected. Sometimes they start with what it looks like to feel disrespected, and then we work on, okay, let's flip that. Let's see what it would be like to feel respected. What would I hear? What would I see? What would be happening? And so there's some core principles that across the world we've distilled, and we find if those 5 core principles are in place, they establish a solid foundation for any group of people wanting to work together, no matter how diverse, no matter where they come from. And that's, the first one is about really honestly embracing diversity. And I think you've really given a great example of that. And that's about really genuinely valuing what everybody brings. What I find in our country, but also overseas, there's this real doing to kind of attitude, and in international development they call it donors and recipients, or donors and beneficiaries. Well, in true partnership, we're all donors, we all give, we all contribute, we all bring our knowledge, skills to the table, our perspectives, our stories, and we're all recipients. We all get something out of it. There's something in it for everyone in a true partnership. And so if we accept that, and then we work with people to acknowledge what everybody brings, and we genuinely, curiously want to understand those different perspectives, even they're different than our own, then we start building that sense of strong partnership and collaboration. And that links to the second one, which is about equity and power, and your story really explains that one too. Because power does get in the way of good partnership. If you've got power imbalances, then who's going to speak up? Who's going to think that their different point of view is valued? And so part of it is also about thinking well with people and having, as Robert said earlier, being explicit. How are we going to deal with power imbalances? What kind of power do we think is playing out here? And just because you don't think you're exerting power doesn't mean other people experience you as having power either. We have to be really clear about, power plays out in all sorts of ways. And then the third one is openness, and that's pretty obvious. You can't go to Bunnings and buy a jar of trust off the shelf and sprinkle it around like fairy dust. So if you can't build a sense of trust and openness in a partnership, then people aren't going to take risks. They're not going to try something new. They're not going to be honest when things aren't working. And so we need to build that. Mutual benefit is really important as well. That principle of the reality is if people are going to commit, there has to be something in it for them. And as you rightly said, Sarah, there's a huge mindset shift that has to happen. And so it's not, for most people, it's not their day-to-day life. So when they're in partnership, there is a mindset shift that has to occur. And so we have to be really strong about why we're working together, and that purpose has to be absolutely clear. And then interestingly, the fifth key principle that we've found worldwide is this work takes some courage, because we are breaking new ground. Mm. We are challenging existing ways of thinking and doing. And the most of the reasons people come together collaboratively is to change the way things are, not to keep having poor outcomes or impacts, not to keep having high levels of incarceration or hospitalizations or whatever it is people are coming together around. And it actually takes a little bit of courage sometimes to challenge those traditional ways of operating. Mm. But our experience collectively worldwide is if you have a principle-based approach, you make those principles explicit, like Robert said, and you work with people in your communities, in your context, to work out what does that look and feel like for us, how would we know if it was happening, and make them incredibly practical, you will have a strong partnership that will weather the ups and downs, the curveballs that always get thrown, because we're dealing with stuff that has no simple solutions. Mm.
I think where you're landing there around resilience is key, you know, and there has to be that acceptance that this sort of community-led collaborative practice, I think it's the hardest way, in a way, to do things. I think it's the only way, but you need to accept that this really is tough stuff, you know, and that there's going to be highs and lows, and all the data that, you know, you read out, there's great wins along the way, but you know, there's can be lots of ups and downs with that, and you don't want to get caught up on, okay, great, we've reached this data outcome, because there's always going to be a lot of stories behind that data, and I think, you know, there's not, you don't reach success and then you're there. It's an ongoing process.
And that was really echoed by Meg on our outcomes panel yesterday as well, I think. Kerry, I'm interested in your perspective on some of that, what you think it takes to partner well or collaborate well, but also when does it just not work?
When doesn't it work? In our experience, leadership is everything. So I think collaboration should not work if you have the solution and you've got the mandate to deliver it. Then you shouldn't collaborate. You should go ahead and work alone.
Just get on with it. Yeah.
Collaboration is very time consuming, and you should only ever really do it if you do not know the solution, which means the problem is complex, and you don't have a mandate, as in you don't have sufficient access to the levers of decision making or power to affect change. So if your mandate's too small, for example, you only work in law or you only work in health, then you have to come together. But the other times I think you absolutely should not collaborate is that if you don't have the mindset or the leadership. So collaborations tend to fail when people are looking for short-term solutions. Burke's history to get to those outcomes you read out, those outcomes were clocked in 2017. That change process formally started in 2013, but probably had 10 years before that. Do you know what I mean? That's to accrue that level of impact. I also think you shouldn't start if you're starting. Your collaboration is less likely to be impactful if your starting position is we need to change services. Because the types of things that we should be collaborating around, we all deliver services. If we work professionally in social change, we are usually delivering services, so they are in place. It's the things that service delivery can't do that we need to collaborate around. So some of that is improving services and making services work better together. But there are a ton of things that need to change that are outside the domain of service delivery. Robert spoke beautifully about them today. What are the incentives in the system? What are the behaviours and patterns that actually hold the problem in place? In some cases, what are the laws? What are the unjust laws that need to change? These are all part of what successful collaborations claim the mandate to do. They don't just say we need better services or more services. They say we need to change the conditions that are holding this problem in place. So it's shifting that mindset to services plus. Like, it needs more than service delivery to get to this level of change.
Can you talk more about that, Kerry? Because I think from the work I see across the health justice landscape in health justice partnerships, there was a really strong origin story of systems change and law reform and systemic advocacy that came from health justice partnerships. We don't necessarily see a lot of it happen now. I would love to see activity around that grow. Your perspective on this is that systems change is a really critical tool to aim for in partnership and collaboration. So what is needed to take that approach?
So I want to out myself first here and say I have massive empathy with you guys. I was a criminal lawyer for 10 years in the Children's Court, and I was the lawyer that set up the Youth Drug and Alcohol Court, which I now recognise as systems change. I then trained in social work and did my master's in case management. I spent the best part of 15 years trying to be a social change agent, where I was trained in problem, technical solution, predictable outcome. That is a root cause problem that we all think. We have a defined problem. We have a technical solution. We have the mandate to deliver. It's got an evidence base. It's going to produce a highly predictable outcome that I now get funded for. Those types of solutions are needed in our social change landscape, but they only address certain types of problems. They do not address complex problems. What I find I had to do as someone who's committed to equity and inclusion in Australia is I had to retrain myself outside of formal training to learn what does it mean to map a system, to see how systems operate, and then work out how do you redesign systems so that they actually change the conditions that are holding the problems in place. So I think there's a thing that needs to happen about building capacity for systems change, because you're not going to learn it in mainstream social change school. I think that's changing, but it's not changing fast enough. So this network, these types of conferences, are sort of the best places you can go to get this type of education, or this skilling up yourself to be able to be a systems change leader. We need systems that serve people. We need systems that address inequity, that hold justice as a core value and principle, until we can be part of seeing ourselves as part of the problem, as well as part of the systems that need to evolve to become part of the solution. Then we're not really going to get the level of change we're all looking for.
Marcia, you've been furiously nodding.
Yeah,
Tell us
I
about
guess
that.
there's two key points in that. Absolutely agree. So if we're outing ourselves, so the other international network I work with is the Cognitive Edge and Complexity Network. And so we know that if there's a complex issue, we can't address it with traditional means. I think part of the issue is that we use the language of partnering, the language of complexity, the language of all sorts of things, advocacy. The group I was with yesterday, we were talking about even evidence means different things in different sectors to different people. And when people talk about partnering and collaboration, they're actually talking about a continuum of different things. So some people are thinking about network meetings, and I can pretty much guarantee you everybody in the room knows what I mean by a network meeting. You go there, you share information, there's a bit of a round robin, you might have guest speakers, and you go away, but nobody expects anything to change. They're information sharing. But people call that a partnership. or when people come together to coordinate International Day of whatever it is, and they bring shared resources to the table, and they're coordinating for important reasons, and they call that a partnership. That's a different kind of thing, though, with different kinds of skills, resources, approaches needed, than if you've got a really messy, complex issue that nobody has the answers and everybody's bringing different perspectives to the table. And unfortunately, what happens is everybody calls those partnerships or collaborations, and they're quite different things. They're different tools for different purposes. So I think part of it's about us getting clear about, do we need to partner? What's the nature of the issue we're coming together around, as Kerry said? If we don't need to partner, if we know exactly what to do, get on and do it. If there's a clear evidence base and we know it's getting great results and everybody's really happy with what's going on, get on with it. But when we've got really messy, complex issues, and internationally the United Nations has the Sustainable Development Goals. Have people heard of those? Initially, countries like ours were signing up to them to do our international development work. But now, increasingly, the United Kingdom, Canada, Australia, other countries are saying, well, actually, the Sustainable Development Goals apply to all of us, regardless of where we live. And one of them is partnership. Why? Because all of the other goals can't be done on their own. You have to work together because they're messy, complex things with no clear solutions. So if we can get clear about why we're coming together and then identify, therefore, what kind of relationship do we need to make it work? Is it a partnership because it's about complex systems or other kinds of change, or is it something else? And then I have to, again, out myself. The reason there's a Partnership Brokers Association is because we realize this work isn't easy work. It takes some skills. It's not just sitting around having lots of cups of tea and have-a-chats. It actually is tricky to actually bring diverse players together who have very different perspectives on things and find ways to navigate, finding new ways of doing things and trying things and seeing what works. And that's scary. Not everybody feels comfortable working in that complex, unknown space. And then you've got to protect everybody from the powers that be who want their KPIs and they want this and that, and you're trying to find something new. And if they put a KPI on it, what does it mean? They know the answer because they can put a KPI on it. So it just contradicted the whole thing. So you're trying to keep one thing moving and protected while you're trying to create something brand new and create something that we don't know existed before.
So collaboration in and of itself is a disruption to the system because most of us are incentivized to compete against each other. So the act of collaborating is disruptive. And if we're going to step into disrupting systems, we have to become really good at knowing how to use authority, how to grow authority for the work, how to work with power, and probably most importantly, how to prioritise the voice of people most impacted. Because unless systems are changing to better serve people who are most impacted, then we probably shouldn't be collaborating either. This work about protection and disruption at the same time, they're sort of almost in tension with each other. We're disrupting and protecting. What we keep finding is that when people who are most impacted are leading, there's almost no need for protection because they're setting the pace, they're determining the level of safety required, and they're actually saying what are the patterns in the system that are most negative and need to change. And then it's just trying to authorise that to be the agenda that everyone cares about. Does that make sense?
So you've both spoken about that notion of complexity and that partnership and collaboration are key tools to use when rumbling your way through complexity. I think it's one thing to say it it's quite another to understand what that means. So for some of the folks in the room, what are some of the tools and strategies you can use to actually make sense of the problem in front of you to determine whether partnership or collaboration is indeed the right approach to take?
I think one of the things, it's really important to come back to that issue around values and the complexity and high level of the change that you're really seeking as well. So with the work with Maranguka Justice Reinvestment in Burke, for instance, there's two very big pieces of work here that we're looking to shift. I mean, one is around how do we change this idea that prisons, there's this endless stream of resources that go into prisons, and yet a very limited stream of resources that go into things that might prevent people from offending and ending up in prison in the first place. So this is a very big thing we're trying to change here. It's changing the way governments and Treasury work. And the other thing, of course, is how do we shift power into Aboriginal communities? So it's really about that power devolution. So that it's an interesting process for us to keep coming back to those key things, and how does that actually guide that work on the ground?
The other thing is, it is about making sense of our understanding of the issues. So I think as human beings, we tend to be natural born problem solvers. I don't know about you, but if somebody starts explaining a problem, I immediately go into thinking about all the other situations I know and what else might be useful and how could this be helpful. And so we go into problem solving mode, and we do it really naturally. It's a human nature thing. And we jump to solutions before we even understand what the issue is. And so part of this, and part of the challenge of this work, I think, is you've heard that kind of, it sounds a bit tree hugger-ish of, holding space. Have you heard that term? Well, what really that means is, how do we stop ourselves jumping to solutions before we truly understand what the issues are? So how do we hold ourselves back so we can look at it from multiple perspectives and make sense of what's going on before we actually start playing around with what could we try that might be different, that may or may not work. And if it's complex, we know it's not going to work the first time, because if it does, we knew what to do. So those of you who were here yesterday, and I think it was Fiona who's doing the systems mapping, one of the key questions Fiona's going to work with people on today is, what's our sense of the current context? And that's one of the key tools and starting points, isn't it? How do we make sense of what the current situation is, but do it from multiple perspectives? Just don't do it from your own perspective or somebody who agrees with you. So looking at things from multiple perspectives, up, down, sideways, and really trying to get a handle on what's going on here before you actually start thinking about what are we going to do about that.
Absolutely. I want to spend a little bit of time before I throw to the floor, because I'm sure there are folks in the room with questions and thoughts and perspectives on what we've been talking about. We've spoken a little bit here about control and relinquishing control, and on what that means in partnership and collaboration, and with that, I think notions of power. Robert spoke about institutional power, institutional culture, incentives over values. I'm taken back to Progress this year, where Uncle Bruce Pascoe called on us all to speak truth to power. I think power comes up as a thorny issue time and time again in partnership and collaboration. So, Sarah, what has that shifting of power, that movement of power, looked like in Burke?
So I think when you talk about the shifting of power, it's very much, there's no past tense in that. It's an ongoing process, and there's daily challenges around it. I mean, it did involve the community coming together, really to seize the power at the outset, to set the agenda and to set the priorities and to create that community strategy, which, as I said before, has set this foundation in Burke, which is solid. So, and it's something that when that power slips, they can keep coming back to that the working groups, the cross-sector group, they've all put Safe, Smart, Strong at the centre of what they're doing. So there's a terms of reference for that cross-sector group, and Safe, Smart, Strong is embedded in that. There's now work at that cross-sector level to embed that community strategy in local service delivery contracts. So you are starting to incentivise organisations in a different way because of the way the community has come together and set that strategy. So there's these sorts of levers that we can keep coming back to make sure the power stays where it needs to be. But as I said, though, there is that toing and froing is a daily business in Bourke. A recent example was a youth hub space has been agreed on and established. One of the youth services had its own idea about what it should be doing and where it should be based and where its resources should be going. And, there's a lot of work that Alistair and other community members need to do on standing their ground, and really just absolutely saying no. Things cannot keep going that way. This is what the community has said. This is where the resources should be. We need to start shifting things around. And so, there's a lot of work that goes stepping up that level of authorisation. So, okay, if we're not getting somewhere with the person on the ground, then we'll need to bring in a senior manager. We might need to go to the cross-sector group. There's a DepSec that's been appointed for the work in Bourke. There's a ministerial cross-sector champion in Minister Hazard. So when the power is not playing out the way it should be, sometimes you need to make those steps up to make sure that things really are happening on the ground.
It's absolutely easier to continue to renegotiate power when you've got a shared agenda, especially in Bourke's case where the shared agenda is crafted, was all of the thought and diagnosis about what needs to change was by the community and and endorsed by a tribal council that is every single clan group that lives in Bourke. So with a shared purpose is an incredibly powerful anchor when you're renegotiating power. But they take years to develop. It takes probably 2 years to develop a shared agenda that has that level of sophistication and community ownership. It's very hard to keep negotiating power in that agenda setting phase because so people arrive with this is the agenda, this is the agenda my organisation will most benefit from, or this is the agenda that government has already set for this region. There's multiple agendas at play, and the art of this work is creating enough safety for people to step in and learn together in a way that allows them to suspend their isolated agenda long enough for a shared agenda to emerge, and a shared agenda that is deeply rooted in the experience of people most impacted by the challenge. So the power, the renegotiation of power shifts as these types of initiatives mature. Do you know what I mean? But Bourke is so smart at leveraging authority. A minister, a DepSec, a cross-sector leadership group, that's all in service of an agenda that was created by people most impacted. It's pretty unique. So it's a challenge to all of us about becoming power literate, becoming very power aware, I think.
I think it's also important for us to really take some time to think about there are different kinds of power and how those different kinds of power play out, and also our own relationship to power, how we personally react to power, how we might become complicit in power playing out because, we might defer to a certain kind of power or whatever. I think one of the other kinds of power that plays out a lot is the power of knowledge and expertise. And certainly that's a conversation I've had with some of you yesterday. If you think about the health system, it's a deeply entrenched expert system. Yeah? Everybody, if you work in health and having facilitated and brokered lots of partnerships in the health arena, first thing they ask is, what discipline are you? And so everything is about your expert role. if you think about the perceptions, and I'm not a lawyer, but my perceptions of legal people and the people I know who are lawyers, there's a deeply ingrained expertise that attaches to being in the legal profession. And so one of the risks when you're in the health justice area and the health legal kind of partnership area is you bring power to the table even if you don't know it, as experts, and you will be perceived as experts. So if you don't actually challenge yourselves about that and each other about that, that power will get in the way. Sometimes what I'll do is invite people to all be experts to level the playing field. Remember equity as a principle, and we actually draw out, what are you expert in? Because the community is expert in all the things that matter. It's the outside experts that are bringing in stuff who think they're bringing in all the things that matter. But how many times have initiatives or reforms failed because nobody talked to the community, the relevant community about it, whoever that community is, and then suddenly they got to implement and it doesn't work because they didn't reality check. For those of you who were here yesterday and heard the Young Youth Homelessness Initiative, Street Care. And the young woman who was head of the youth advisory group saying, and when we meet with government, we try and make their initiatives less bad. That's exactly what happens all the time. And so if we're working in collaboration, in fact, in shared leadership with the community experts, whether that's young people, whether that's Aboriginal and Torres Strait Islander communities, whether it's children and families, whoever it is, it's not about making it less bad. It's actually bringing all our shared expertise to the table to co-create something new. And that's where the magic happens. That's where the cool stuff happens.
So I've been a terrible timekeeper and I have left, I think, 1 or 2 minutes for questions. Is there anything that anyone has? We've got a question right up the back there.
Thank you, Marissa Marioli from the Peter MacCallum Cancer Centre in Melbourne. I'd just like to ask the panel a question and maybe out to the floor. I've got a bit of a vision with patients, clients with those complex issues. Has anyone attempted or thought about, in a hospital setting, we have what's known as MDMs, the multidisciplinary team comes together. It would be a space to have the legal representative in there, the lawyer in there as well. They're talking about treatment options. They're talking about date of discharge, what trials are available, what's, psychosocial, physical. What about the other? What about everything else, that big other that they talk about the person's well-being, so to speak, but not about, so what's going to happen when they do get discharged?
I think for services on the health justice landscape, I think that's certainly something that some of the health justice partnerships we work with consider as a potential activity for the work they do, and I'm sure there are other health justice partnership practitioners in the room who would love to connect with you on how they go about doing that work. Do any of the panellists have?
Sounds like a great idea to me.
Yeah, absolutely.
Agree.
So before I invite the panellists, sorry, was there a question down the front?
You got time?
Yeah, go for it.
Mick Madden, Health Justice Officer, Orange Aboriginal Medical Service. Sarah, I was just wondering, as a part of the model in Bourke, was the Aboriginal Medical Service a part of that model out there? And if it was, how did it work?
Yeah, so thanks for that question. The Bourke Aboriginal Health Service BARS is a really important part of the whole collaborative process. They sit on the working groups. They've had a particularly strong role in the early childhood working group. So one of the key initiatives of that group was around introducing universal 3-year-old health and development checks and ensuring the service system could meet the needs in terms of referral and follow-up. So yeah, BARS has played an important role, particularly in that area. There's sort of ongoing opportunities, I think, for a stronger role as well in terms of therapeutic support for 8 to 18-year-olds, as well as those sorts of supports in the role of men in some of the initiatives that they're pursuing right now, and particularly in terms of outreach services in the men's space.
Okay. Just a quick supplementary, if I could. Would you think it would work better if there was a health justice officer embedded in the health service to work within the model? Would that be an assistance?
I actually think that there's great scope for bars, for the Aboriginal community control organisations to have these sorts of roles. So if there was a health justice officer sitting in bars, I also think that in the Aboriginal legal service there should be a justice reinvestment or health justice community development role embedded in that service, so that these Aboriginal controlled organisations can play pivotal roles in these processes, in these change processes. Yeah.
Absolutely. Well, both Sarah and Marcia will be running workshops this afternoon to deep dive some of the issues we have spoken about here this morning. But for the moment, would you please join me in thanking Sarah Hopkins, Kerry Graham and Marcia Dwonzcyk.
Thanks, Lottie.